Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. How can I assist you today?
I've been noticing some bleeding in my gums, especially when I brush or sometimes when I eat something hard. My gums seem to be red and swollen in certain areas. This has been going on for a couple of months now.
Have you noticed any pain or tenderness in those areas? And how about any bad breath or foul taste?
Yes, there's a bit of tenderness and discomfort. I've also had persistent bad breath despite maintaining oral hygiene.
How often do you brush and floss your teeth?
I brush twice a day, but to be honest, I rarely floss. Maybe once in a couple of weeks or so.
Flossing is crucial in maintaining gum health. How about your diet? Do you consume a lot of sugary foods or drinks?
I do have a sweet tooth. I consume sodas and desserts quite frequently.
Sugary diets can contribute to dental plaque and exacerbate gum problems. Have you had any dental procedures done recently or wear any dental appliances?
No, I haven't been to a dentist in a few years. No procedures or appliances.
All right. Based on your description, it seems you might be suffering from gingivitis, which is an inflammation of the gums. It's essential to address this early to prevent progression to a more severe form of gum disease called periodontitis. Have you noticed any gum recession or loose teeth?
Not that I've noticed, doctor.
That's a good sign. Do you smoke or consume alcohol frequently?
I drink occasionally, but I don't smoke.
Smoking can be a significant risk factor for gum diseases. It's good you don't smoke. Let's talk about treatment. Firstly, I recommend a professional dental cleaning to remove the plaque and tartar buildup. This will be done by a dental hygienist. Following the cleaning, you should notice a reduction in redness, swelling, and bleeding.
And what about the home care? What can I do to prevent this from happening again?
Excellent question. Firstly, brush your teeth twice a day with a soft bristled toothbrush and fluoride toothpaste. Make sure to floss daily, as it removes plaque from areas your toothbrush can't reach. Rinse with an antiseptic mouthwash to help reduce bacteria that cause gingivitis. Lastly, consider reducing your intake of sugary foods and drinks, and visit your dentist for regular checkups and cleanings.
Will do, doctor. Thank you for your guidance.
You're welcome. Remember, early intervention and maintaining good oral hygiene can prevent many dental problems. Take care.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Can you help me understand why you've come in for this consultation today?
Hi, yes. Over the past couple of weeks, I've been experiencing some discomfort, and after some research, I suspected it might be urethritis. That's why I wanted to see you.
I see. Could you be more specific about the symptoms you've been experiencing?
Sure. I've been feeling a burning sensation when I urinate, and sometimes I notice a slight discharge. It's quite uncomfortable.
I understand, and I'm glad you've come in. It's important to address these symptoms. How often would you say you experience this burning sensation?
Almost every time I go to the bathroom, so several times a day.
Have you noticed any other changes, such as a change in the smell or color of the discharge or urine?
Yes, the discharge sometimes looks a bit cloudy and has an unusual odor.
Noted. Do you have any pain or discomfort in the pelvic region, or have you experienced any spotting between periods?
Not really any pelvic pain, but I did have some unexpected spotting a few days ago, which was unusual for me.
Have you recently changed sexual partners, or have you had unprotected sex in the recent past?
Well, I did have a new partner about a month ago, and we didn't always use protection.
All right. It's essential to understand that urethritis can be caused by various factors, including infections from sexual activity, but we'll need to conduct some tests to determine the cause and the best course of treatment. In the meantime, I would recommend refraining from sexual activity until we get the results back.
I understand. I'm just concerned and want to get to the bottom of this.
Absolutely. Your concerns are valid and will ensure you get the right treatment. Do you know if anyone in your past relationships has ever mentioned having similar symptoms or being diagnosed with an STI?
Not that I'm aware of. I've always been quite cautious, but I guess things can happen.
They can. It's always a good practice to discuss these things with partners and get regular checkups, especially when engaging with new partners. We'll make sure to give you all the information you need moving forward.
Thank you, doctor. I appreciate your guidance.
Of course, we'll get those tests scheduled and I'll ensure you're taken care of. Remember, urethritis is treatable, and the sooner we address it, the better.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Mrs. Carter, after reviewing your hearing test results, it appears there's a mild hearing loss, particularly in the higher frequencies.
I've noticed that, especially when I'm in a crowded place. I find it hard to pick out voices or hear someone speaking to me from a distance. TV sounds are also muffled sometimes.
Those scenarios often highlight hearing difficulties. The good news is that with the right hearing aid, we can amplify those higher frequencies, making speech clearer for you.
I've been resistant to the idea of wearing a hearing aid, but if it can help improve my quality of life, I'm willing to consider it.
That's a great perspective. Remember, early intervention can help prevent further deterioration and make social situations more enjoyable for you.
Now look at question 26.
Recent studies have shown promise in a new approach to treating migraines. Instead of merely targeting the symptoms post-migraine onset, the focus is now shifting towards prevention.
That's intriguing. Are we looking at medications or lifestyle interventions?
Both, actually. On the medication front, CGRP inhibitors are a new class of drugs showing potential in preventing migraines. They block a molecule involved in migraine attacks. Alongside lifestyle interventions, particularly stress management and avoiding known triggers, are being emphasized more than ever.
With how debilitating migraines can be for patients, any advancement in preventing them is a step in the right direction. I'll definitely be keeping an eye on the CGRP inhibitors.
Absolutely. It's crucial we stay updated and offer our patients the best possible care based on the latest research.
Now look at question 27.
So you've been feeling unusually tired lately?
Yes, especially in the afternoons. It's like I hit a wall and can't get through the rest of the day.
And you mentioned you've been more short of breath during walks?
Exactly. I used to walk around the park without any issues, but now even a short distance leaves me gasping.
Are there any chest pains or palpitations to accompany this?
Sometimes I feel a weird flutter in my chest, but no pain.
Given your symptoms, I think we should run some heart tests just to be on the safe side.
I was afraid you'd say that, but if it's necessary, then let's do it.
Now look at question 28.
Good afternoon. I see there's some redness and itching on your arms.
Yes, it's been bothering me for weeks now. At first, I thought it was just dry skin, but moisturizing hasn't helped.
Have you switched to any new detergents or skincare products recently?
Not that I recall, but I did start a new job, and the office is quite dusty.
Dust and certain environmental factors can sometimes trigger skin reactions. Have you ever had something like this before?
No, this is the first time, and it's driving me crazy.
It's essential to identify the cause to treat it effectively. In the meantime, I can prescribe you something for the itch and inflammation.
That sounds like a plan. I just want some relief.
Now look at question 29.
You mentioned that you've been struggling with your vision, particularly during nighttime. How severe would you say the problem is?
It's gotten much worse lately. I find it challenging to drive at night because the streetlights and car headlights seem blurry, almost like there's a halo around them.
That can be a sign of cataract development. Have you noticed any yellowing or clouding of your vision during the daytime?
Now that you mention it, yes, things do seem a bit less bright and clear.
Well, I recommend we conduct a comprehensive eye exam. Early detection and treatment can be quite effective.
I'm a bit worried, but if it helps improve my vision, I'm all for it.
Now look at question 30.
I've been reading up on COPD, but I'm still trying to get a grip on the primary symptoms to watch for in patients. Can you clarify a bit?
Certainly. Patients with COPD often present with a persistent cough, which might be productive or dry. They also experience shortness of breath, especially during physical activity, and might have a wheezing or chest tightness. Frequent respiratory infections can also be a sign.
And what about the risks associated with it?
Prolonged exposure to tobacco smoke is a significant risk factor, but other pollutants and occupational hazards like chemicals or dust can contribute. Genetics and a history of frequent lung infections during childhood can also increase the risk. It's essential to recognize these signs early and intervene because over time, COPD can lead to heart problems and other serious complications.
Thanks for the clarification. It helps to have practical insights from someone experienced in the field.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good evening to all, and thank you for joining us for the next segment in our Medical Insight series. Tonight, we'll delve into a groundbreaking approach in the management of depression. Please welcome Dr. Evelyn Ross, a leading expert in psychotherapy and its evolving methods.
Thank you for having me. It's an honor to discuss our recent progress, especially in such an important field as mental health.
Absolutely. Mental health has become a pivotal conversation globally. So, to kick things off, could you give us a brief rundown of what's been happening in the realm of psychotherapy for depression?
Certainly. Over the years, psychotherapy has been one of the cornerstones of treating depression, alongside medications. However, recently there's been a paradigm shift. We've been integrating technology, particularly virtual reality, VR, into cognitive behavioral therapy sessions for patients suffering from depression.
That's intriguing. So you're saying that virtual reality, the technology we often associate with gaming, is now being used as a therapeutic tool?
Exactly. The idea is that VR can create immersive environments that can aid in exposing patients to scenarios where they can confront and process their emotions under controlled conditions. This way, we can tailor therapy sessions to the specific needs of each individual.
So it's like a more controlled form of exposure therapy.
Precisely, and the initial results are promising. Our trials have shown that patients using VR-assisted therapy often show quicker progress, especially in terms of emotional regulation and resilience.
This sounds promising indeed, but one has to wonder, are there any risks or downsides to using VR in therapy?
As with any tool, it's not without its challenges. Some patients might experience discomfort or disorientation in a VR environment, but we closely monitor them and ensure that the sessions are adjusted to their comfort levels. It's crucial to remember that while VR is an incredible tool, the real therapeutic work still lies in the therapeutic relationship and the insights gained during sessions.
Absolutely. It's the combination of technology and human connection that seems to be the winning formula. What's next in this line of research?
We're now looking into incorporating biofeedback mechanisms into the VR systems. This would allow us to get real-time data on patients' physiological responses during therapy and adjust the VR environments accordingly.
That sounds groundbreaking. Looking ahead, how do you see technology further shaping the landscape of mental health treatment?
I believe the future is integrated. Combining traditional methods with advanced technology can offer more personalized and effective treatment modalities. We're only scratching the surface, and I'm optimistic about where we're headed.
The future indeed looks bright. Thank you, Dr. Ross, for shedding light on such an innovative approach in mental health. We eagerly await more advancements from your team.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, I'm Dr. David Matthews, and I'm here to discuss a common health condition many of us have experienced or heard about, which is laryngitis. Laryngitis is an inflammation of the voice box, or larynx, which leads to symptoms like hoarseness or even loss of voice. Why does laryngitis occur? Well, when I was in medical school, a common misconception was that yelling at a concert or a sporting event was the primary cause. While overuse of the voice is indeed a cause, there are multiple reasons why someone might develop laryngitis. In many cases, it's viral. Just like you might get a cold, you can get a virus that affects your larynx. There's also bacterial laryngitis, which is less common but potentially more severe. And then there are other triggers like allergies, acid reflux, and even prolonged dry air exposure. Let's debunk a few myths about laryngitis. One common myth is that whispering is good when you have laryngitis. Surprisingly, whispering can actually strain the voice more than regular talking. Another misconception is that cold drinks worsen laryngitis. While they might feel uncomfortable, cold drinks don't necessarily harm the voice. Now about smoking. We all know smoking isn't good for our lungs, but it's also terrible for the larynx. Chronic exposure to smoke can lead not just to laryngitis, but to polyps or nodules on the vocal cords. Speaking of treatments, how do we approach laryngitis? For viral causes, the body will typically heal on its own, but rest is crucial. Giving your voice a break is like allowing a sprained ankle to heal. If the cause is bacterial, antibiotics might be necessary. For those with acid reflux-induced laryngitis, antacids or lifestyle changes may be recommended. In the realm of diagnostics, while a person's description of their symptoms can often lead to a diagnosis, in persistent cases, a laryngoscopy might be used. This procedure allows the doctor to see the vocal cords directly. Many fear this might be an invasive procedure, but it's relatively simple and can provide a wealth of information. Patients often ask, "Will I permanently lose my voice?" Thankfully, most cases of laryngitis are acute and temporary. But if someone continuously strains their voice or is exposed to irritants, they might develop chronic laryngitis, which can lead to lasting voice changes. Recent advancements in treating laryngitis are exciting. While we're still learning, therapies involving controlled vocal exercises with speech therapists show promise in speeding recovery and even preventing recurrent episodes. We're also exploring the benefits of humidified air and certain anti-inflammatory agents in managing laryngitis. In conclusion, just as with osteoarthritis and joint health, the best approach to laryngitis often involves a combination of medical intervention, lifestyle adjustments, and preventative measures. The voice is a precious instrument, and it's crucial to understand and care for it properly.